Well, welcome. That was nice to hear Peter Allen as those of you were gathering. Welcome to another Ardenwood Presents. This is one on Medicare for Christian Scientists. I'm John Mitchell, and I serve as Executive Director and CEO for Ardenwood here in San Francisco. Our webinars are designed to inspire, inform, and educate not just patients and residents here at our facility, but all of you, wherever you are, and we're grateful so many have joined us today. Before we get underway, I want to alert you to 3 upcoming online events this fall. On Thursday, November 7th, we will host a different take on estate planning. This webinar will feature 2 speakers. First, Madeline Maupin, talking about the Bible as a source book on how to leave a legacy. And second, Keith McNeil, talking about Mary Baker Eddy's approach to estate planning and her legacy. The following Thursday, November 14th, Rick Bailey will walk us through several options to include in one's estate plan. And the third event is a perennial favorite, our annual Christmas celebration on Sunday afternoon, December 8th. That's the second Sunday in December this year. Please check our website, ardenwood.org, for details and to register for each of these upcoming online events. We'd love to see you whenever you're here visiting in the area or would like to come for a rest and study visit. Our rooms are beautiful and welcoming. Our Bible research library and study rooms are open 24/7, and our food is fresh and delicious, according to all the feedback we've received. Simply call our front desk to make a reservation to enjoy a meal or to spend the night or a longer stay with us. You and your family are welcome anytime. We look forward to seeing you. Now, as a 501c3 charitable nonprofit organization, Ardenwood supports the ministry of Christian Science nursing with the expectation of full and permanent healing. We provide skilled Christian Science nursing care. We offer Christian Science nurses education and training. We present online events like this one. Your financial support of all our programs and services is essential, and we're thankful for each and every donation. It means so much. And now, let's talk about today's webinar on Medicare. Why is this information important for Christian Scientists to know? Well, because it's a big help when it comes to paying for skilled care. Now, by definition, skilled care is the kind of care someone would receive in a hospital. And friends, it's expensive. We have all paid in Medicare throughout our working lives, paycheck by paycheck. Hopefully, one will never need skilled care. But in the event that one does, Medicare is an option for those who are 65 and over. And let me make a very important point here. There is no difference in the care you receive at Ardenwood if you are on Medicare, if you are on Medicare or not. It's exactly the same care. And we are simply not endorsing Medicare per se. Medicare helps you pay your bill. Ardenwood is designated in federal law as a religious non-medical healthcare institution, or RNHCI, RNCI for short. As a RNCI, once again, a religious non-medical healthcare institution, Ardenwood is a Medicare Part A provider. One misperception of Medicare is that it wants too much information about your physical well-being. Well, as you know, Christian Science nurses do not diagnose, so we report only general information to Medicare. And for them, as the payor, Medicare simply wants to ensure the care you received should be covered. In other words, if you weren't at Ardenwood or at another RNCI facility, your care needs would require a hospital setting. From many years of experience, we have found Medicare to be much less intrusive than most insurance companies. I also want to emphasize the wisdom of having a care plan and of sharing it with your family or designees. If you have a need to go to a Christian Science care facility like Ardenwood, you want your focus to be on God and healing. not on how to pay for your care. Thinking through your options in advance is a support to healing. It's also support to those who love and care for you. One last point here. Medicare is also very helpful if for any reason you find yourself in a care setting that's not your first choice. Finally, the content shared today is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website in the next day or so. Replays of all our webinars are also on our website. Now, let me present our presenters. Let me introduce our presenters. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's also a certified long-term care insurance strategist. Jim has talked to literally thousands of Christian Scientists. You're still talking to us, Jim, which is a good thing. Talking since our first webinar, answering innumerable questions about Medicare, long-term care insurance, and estate planning. He's a tremendous resource and a blessing to our field. Katie Burris is a Medicare specialist and a certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew and Maher Insurance Services and has been in the business for nearly 20 years. She's licensed for life insurance, long-term care, and Medicare in several states. Katie has talked to almost as many of you as Jim has. And from what both Jim and Katie have said, they love meeting and working with all of you. Nancy Sedan is our Director of Finance, and in her work for Ardenwood, she has gained extensive experience working with Medicare and other health insurance policies. She, too, is happy to answer any questions. Today, Jim, Katie, and Nancy will provide an update on Medicare plans that best serve Christian Scientists, and then we'll answer your questions. As a reminder, you can ask questions using the Q&A button at the bottom of your screen. Let's get started. Jim, Katie, and Nancy, it's all yours.
All right, thank you, John. Hi, everybody. I'm Jim, and this is Katie, and we're going to tell you a little about ourselves. But hey, John, it's been an absolute pleasure dealing with Christian Scientists from all over the United States, literally from Washington to Maine to Florida to Southern California,
Hawaii.
to Iowa, to Hawaii, Alaska. We have talked to thousands, and it's our pleasure. Really, we've learned a lot from you too, right? It's kind of an educational process for us also, but we really do enjoy helping as many Christian Scientists as possible. So I've been doing this. This is my 35th. I get started my 36th year, which means I'm getting older, but I absolutely love doing Medicare. We do it day in and day out, and it's getting busy around here, and Katie's going to tell you why in a bit. But I am a certified senior advisor specializing in Medicare. I guess I'm a Medicare specialist. I've been a long-term care insurance strategist since 1989. So back then they called it something different, but that's simply just to prepare, like John says, right? You want to prepare for events that may or may not happen, but you would do it out of love to your family, right? To take care of them and protect assets from spend down, things like that.
And I'm Katie Burris. I'm a Medicare specialist as well, certified long-term care consultant. And at the end of the day, we are broker consultants. We specialize in Medicare and long-term care. I want to make it known, we have to tell you, we are not affiliated with any government agency, not Medicare, Social Security, or any other agency. And our goal is to help mitigate healthcare costs in retirement. So today's agenda, we are going to talk about what's going on now. We're going to talk about Medicare basics, what Medicare covers, supplemental coverage, and long-term care. So right now, in case you haven't missed all of the commercials, advertisements, mailers, billboards, infomercials, Medicare is having their annual enrollment period, or also referred to as their open enrollment period. That runs from today, October 15th, until December 7th. And this gives people that currently have Medicare insurance options the chance to make changes or add coverage. So if you have a Medicare Advantage plan, you can change from one to another. You can cancel a Medicare Advantage plan and go back to original Medicare. Adding insurance, the supplement, may have to answer health questions, and we'll go over that. And you can add, change, or drop a prescription drug plan.
So now, like the slide says, we've talked to so many, and some of you think you don't have a Medicare Advantage plan, and surprisingly, you do, right? You may not have purchased it, somebody may have sold it to you, whether through a commercial or if you reply to one of the Joe Namath commercials on TV. A lot of times they were taking information and you thought they were going to call you and they were enrolling you. So we've talked to some people out there that have enrolled. So this would be a time that we can undo that, right? Because as we're going to go through this, and Nancy will confirm too, Medicare Advantage plans aren't what you want to really have if you're going to receive spiritual care at Ardenwood or any of the Rinkies across the United States. So we're going to talk about how to undo that today also.
So Medicare basics. When we're talking Medicare, Medicare has two parts for original Medicare. And original Medicare is what you get through the government. So Part A is the hospital or the Rinky insurance side. And we do have that if they're religious, non-medical healthcare institution. Rinky is just not as much of a mouthful for me. Or Part B is the medical insurance side. So once you have those, there are actually 3 times when you can get Medicare A and B. The first time is when you turn 65 and you have a 7-month window. So you have the month you turn 65, but then you also have 3 months before that and 3 months after that. This would apply if you retire before you're 65, or if you are not on a group plan with more than 20 employees, then you would want to sign up for Medicare A and B during this time.
Right. The government really gives you a 7-month window not to blow it. And if you do, you're going to be subject to fines, right? But they're not going to come out and tell you it's time to enroll. The only time you're automatically enrolled into Medicare Part A is if you're over 65 and you're receiving Social Security benefits. If you are, then you're automatically, they're going to send you that Medicare card that Katie showed, Parts A and B. And if I'm still working, for example, I don't have to take Part B. I don't want Part B, but it is required to have Part A because Part A is premium free. So the government does require you that you do have that. But again, a 7-month window, not to blow it. And if you do, like we're going to talk about these penalties, and the penalties last forever. It's not just like, well, gee, it's not like the IRS, oh, one time we're going to fine you. These last every month for the rest of your life. So we're going to tell you how to avoid that today.
The second time is a special enrollment period. So if you are working past 65 and you're on a group plan that has more than 20 employees, that is the magical number, then you do not have to pick up Medicare A and B when you're working. What you would want to do, technically, you have 8 months once you lose the group coverage to go onto Medicare A and B. You don't want to wait those 8 months. What you would want to do is coordinate it. So let's say you're retiring December 31st, 2024. You would want to make sure that Medicare A and B start January 1st so you don't have any break in coverage.
What that really means is you need to call us in like September. You don't want to call us on, day after Christmas and say, hey, I think I'm supposed to enroll. You don't want to do that. You want to give yourself a really long runway to make a smooth transition from where you're at now and then going on to Medicare. So if you allow yourself plenty of time, it just makes it so much easier instead of having to rush and try and get something done at the last minute.
What we have found is that when you need something to go fast, it will take a long time. And when you do something and you plan early, it goes fast.
Right. And especially with the holidays coming up too.
Yeah.
That really clogs up Medicare and Social Security right now at the end of the year with the open enrollment and with the holidays. So you really want to allow yourself plenty of time early. Like my parents were, hey, if you're supposed to be there at 7:15, you get there at 7. Same with Medicare. If you want to start that, January 1, you want to contact, 3 or 4 months in advance at least. Always be early.
What they don't tell you is that there are some plans like Medicare Advantage or prescription drug plans that do not give you that 8-month window. They only give you a 2-month window. So really, you just want to make sure everything's coordinated. And like Jim said, if you have questions or you're getting ready to retire and this applies to you, call us a few months ahead of time and we can help. The last time that you can enroll is the general enrollment period. That happens one time a year. So let's say I am 70 years old. I retired before I was 65 and I didn't sign up for Medicare when my 65th birthday happened. And now I want to enroll in Medicare Part B or Part A or both. Then what I would need to do is I have to wait until January 1st through March 31st. That would be when I can enroll.
You can't just randomly, and people think that, right? So if I missed it and my birthday was in July, I'm going, well, I think now I'll call in. That's not how it works with the government. You have to wait until this time frame. And normally, once you hit that first 12-month period, it's a 10% penalty, right, on the Part B premium for the rest of your life. But if you miss 2 of those, it's 20%. If you miss 3 of those, that's 30% and so on. So the goal is to understand your options and make sure you're aware of, that penalty and how to avoid it.
And at that time, you can also add the supplemental or the insurance coverage. And when you apply during this window, the coverage would be effective first of the month. So if you apply in January, it would be effective February 1st, February would be March 1st, and March would be April 1st. And so what we have seen is sometimes that you cross another 12-month period while you're waiting for that to start. What does Medicare cover? One of the questions that we get asked most frequently. So Medicare has the 2 parts. They have Part A, the hospital insurance side, that also covers Christian Scientists if they need to stay in a rinky. The Part A is premium free if you or your spouse has worked and paid into Medicare taxes for 10 years or longer. And the coverage is nationwide.
So what always helps me when you talk about Part A, right? Because we do it all the time, but if you haven't seen this or your first time here, your A and B and C and D and G and all that, all the letters. So if you think of A as the government, that's the accommodation side to Medicare. You're going to spend the night somewhere, right? The accommodations, I'm going to spend the night overnight if it's at Ardenwood, for example, or if not, if it's a hospital. Skilled nursing, that's also under Part A, where you're going to spend the night somewhere. And finally, hospice benefit is end of life benefit, and that's also covered under Part A. So Part A, you always think of, okay, you're going to spend the night somewhere.
So with Part A, they have what they refer to as benefit periods. So it's not like normal health insurance where you have like a deductible that's for the calendar year or anything like that. With Part A, they refer to benefit periods, meaning when you're admitted as an inpatient to a rinky or a hospital, that benefit period starts. For the first 60 days, there is a deductible of $1,632 under Part A. We're assuming you don't have any other insurance, you just have Part A. Days 61 through 90, if you're still in the facility and it's still a Medicare approved stay, your costs are now $408 a day. And if days 91 through 150, that would be $816 a day. But you'll notice there that it talks about lifetime reserve days. So anytime you're in a rinky or a hospital and day 91 hits, you start taking from those 60 lifetime reserve days. The benefit period, you can have more than one in a calendar year, because once you leave a hospital or a rinky and you go more than 60 days without care, if you have to be readmitted, it starts over again with a new benefit period.
That's right.
Anything we're missing on that, Nancy?
No, that's really clear. No.
It gets expensive, sometimes when you show these numbers, you think, well, that's not a big deal, 408 a day, until you have to write a check, right? Once you start writing checks, it becomes
That's when my
real.
hands start shaking.
And people go, well, I don't want to pay that, which I do. And I go, well, we should have talked a couple of years ago. But ultimately, it's easy to put those numbers up there. And we're going to show some pretty big numbers here. But it really does. It's kind of scary when you have to write a check like that.
Mm-hmm. Then the other part of Original Medicare is the medical insurance part, Part B. So with Part B, that does have a premium. The monthly premium in 2024 is anywhere between $174.70 or $594. And that is a really big window. That number is based on your 2022 tax return. And we do have the bracket, so we could always send you. So if you want to see how that applies. With that, you can actually request a reduction if you're in one of those higher brackets, if you've had something happen, a life-changing event. So commonly we see people are picking up Part B because they're retiring, and so their income's going to go down. It's not what it was a couple years ago.
Right. Katie's exactly right. So the confusing part about all of this stuff is you think you'd just be calling a Medicare office or going down there. Unfortunately, it's the confusing part is you're dealing with Social Security. They handle the enrollments and the money side for Medicare. So Katie's exactly right. We have a lot of clients that come in and say, gee, I made all this money, but I'm retiring. So they do recognize, Social Security recognizes life-changing events such as work stoppage or work reduction, as they call it, as a life-changing event. And that would allow you, so if you're a higher earner and you have an IRMA, which is really just an additional surcharge, a tax, right, by the government, it allows you to go and say, hey, I don't have that income right now. I'm no longer working, and please help me. And we've seen numerous examples. We've helped numerous clients get that lowered right away. So they're really good about that. But you don't want to just sit there and take that notice and pay it if you have something can prove that I'm no longer working, right? Or my also, if a spouse dies, that's another life-changing event. They'll take that into consideration too.
Mm-hmm. With Part B, coverage is also nationwide, and you can see any provider that accepts Medicare. Part B also has that late enrollment penalty that we've mentioned. So that 10% for every 12 months that you should have had Part B and didn't. The next slide, we're going to show you what Part B covers. And then in the kind of bigger blue font, you'll see those are common what we see Christian Scientists, where Part B would kick in if you needed an X-ray, a bone set, an ambulance, or some sort of emergency room visit, something like that happens. The cost for Part B. So when you go in, if you need to use the Part B, you have a deductible. In 2024 is $240. After the deductible, you are responsible for 20% of the cost, but there is not a cap.
That's a big deal. You need to make sure you understand that. So if you had an emergency situation arise and they take you to the emergency room and they start doing some x-rays, or if they take an advanced imaging like an MRI or something, I've seen MRIs and CAT scans billed out at $20,000, $30,000. So if you just have Part B, you're on the hook for 20% of that. We've seen stays in the emergency room, it's ridiculous to say $20,000 or $30,000, but it's out there. And you go, well, I've got to pay 20% of that. So you're going to have to write a check for that amount. But if something happens to you again later in the year, if you have another accident or a fall or a stumble, right, you're on the hook for another 20%. So just having original Medicare, I mean, it's good, right? It's better. It's kind of a safety net, but still you're on the hook for 20%. So we're going to show you options today to make sure you understand that there are plans out there that will pay that and cover your stay at Ardenwood, for example.
What we hate is when we talk to people where they didn't understand the costs for just having original Medicare, or that there was insurance options out there. They didn't maybe think that was a good fit. And so we just want to explain what the costs are ahead of time so that you're aware of what the liability could be. When we're talking original Medicare, does not cover everything. So original Medicare does not cover all the costs of your care. So we talked about the deductible, we talked about the 20% on Part B and the costs for the hospital or Rinky side. It doesn't cover prescription drugs, dental, vision, or hearing, and it does not cover long-term or custodial care.
Right. The most common question we get when somebody goes, well, I'm going to enroll for Medicare, what about dental and vision? That's normally the next questions we get. Medicare doesn't cover that. We talked earlier about the Medicare, the HMO type, the Advantage plans. One of their big selling points is, well, if you sign up for us, we have some dental and vision and hearing. It may not be very good, but it's free, right? They're going to give it all included for that zero premium or very low cost premium. So I've seen people sign up for plans simply to get that dental and vision. And sometimes that's not really, it's not a good decision, right? You just do it because I want to get the free dental and vision. A lot of times in the long run, that can cost you, right? By having a stay at Ardenwood, for example, that's going to cause problems later on.
And then original Medicare does not cover care received outside of the US.
Right.
So insurance options, the first one being that you can look at once you have original Medicare in place, then you can look at a Medicare supplement and adding a prescription drug plan. Most Christian Scientists don't add a prescription drug plan, but it's separate and optional.
And it took us many years, right, to figure that out, Nancy.
We're slow learners.
We're slow learners, but we're so used to saying, well, you need to get a Part D plan. And, so many Christian Scientists have incredible health. The law go, well, I don't take prescriptions. I don't ever intend to take prescriptions. So why should I pay an insurance company, monies for that? And, after a long time, I agree. It's a personal decision. The fines, there are fines, but they're not as great as the Part B side. Mm-hmm. So I totally agree. I always tell people, think about it, pray about it, decide if it's for you. And if it's not, that's okay. You don't need to do that.
Mm-hmm. Medicare supplement plans are also referred to as Medigap plans because one of the things that Medicare loves doing is being confusing. You will see multiple times that 2 or 3 terms mean the same exact thing. So you must be enrolled in Medicare A and B to pick up a supplement. And the supplement is there to help pay the cost that Medicare doesn't. So it acts as a secondary coverage. It does not make any medical decisions. It does not approve anything. If Medicare covers something, the supplement comes in to help you pay those claims. The plans are offered by private insurance companies, and they can help limit your costs in a rinky.
Big time, right? I mean, it really is. And like Katie says, with original Medicare, there is no network. As a Christian Scientist, you can go to a Rinky. You can also, in emergency, go to any hospital or provider that takes Medicare, which is almost everyone throughout the United States. So again, there's no network. A lot of people get used to being on a PPO or an HMO when they're working lives. Original Medicare, I love original Medicare because it's simple, right? There's no list. If your provider, your doctor, a hospital, or facility accepts Medicare, you're in. It's that easy. It really is.
And lastly, they're guaranteed renewable. That's important because the insurance plan cannot target you if you have large claims. That's one of the things that we get worried calls from people all the time where they go, I've been in the hospital, or I had a large surgery, or I was in a Rinky for an extended stay, and I'm worried that my insurance plan is going to cancel me, or I'm going to have a large rate increase because I use the plan. They cannot target you like that.
They can't single you out, right? They just can't, and it scares people, right? Mm-hmm. As we age, you worry about things like, well, what if they don't cover me? But these are the standardized plans in most every state. I think there's a couple like Minnesota. There's 3 states that have, they don't call them Plan A through N. But the most popular ones we see are Plan G, like George, and Plan F, like Frank. And they're excellent plans. You always want to make sure you've got a solid insurance company right behind that. But you can see there, like with Plan F, for example, I think we're going to talk about that too, give an example here in a minute, if they have complete coverage. But you can see all the boxes checked. So if I'm in a Rinky or any other hospital, I'm covered in full, right? And
what we see most popular nowadays is Plan G. So Plan F, the premium is quite a bit higher than Plan G. And the only difference, if you look in the Part B, the annual deductible, the part or Plan F covers that, Plan G does not. So that's where we talk about that $240 deductible. Plan G has that deductible.
Right. So let's stay on that for a second here. So Plan F, let's say you're paying $50 more a month than you would for Plan G. It really depends on what state and area and zip code and all that, but let's just use that example. So you go, well, I'm paying $600 more for Plan F than I am for Plan G. And I go, well, if you went to Plan G covers everything that F does, but you have to pay that $240 deductible.
Are you going to make me do math?
No, because it's good. So basically, you're about $360 to the plus, right? If I went from Plan F to G.
Okay.
And so therefore, you go, well, if I save $360, I have the same exact coverage as I would if I had Plan F. So I know we're using simple math. Sometimes the math works really well, and sometimes it doesn't. I did one the other day where it was only savings of like $25 a month, $300 a year. So it wasn't worth it. It was easier to stay on Plan F, quite honestly. But Plan G is the most popular plan out there now. I actually have it myself. I love it. It's easy. It covers everything wherever you go, with the exception this year, that first $240. And shocker, the government said it's going to go up next year. I know, hard to believe it's going up, but it is. It's going to be about $255, they think, next year. But that's my out-of-pocket exposure.
The other thing on Plan F and Plan C is you did have to be 65 prior to January 1st of 2020, or you were born in 1954 or earlier in order to get Plan F.
Right.
So when we talk about those Part A costs, so we went over that really awful looking number. If you have, in this case, Supplement Plan G, and it's a Medicare approved stay, you don't have to worry about those costs. The supplement will cover that, and up to actually an additional 365 days.
And Nancy, there's something about peace of mind, right? When people know it's zero. It really is. I mean, we have clients call all the time when they're in the hospital and say, oh my gosh, I'm so worried about my cost. And I've had people call from Stanford. We've had people there and say, I've been there 3 weeks, something serious, how much I'm going to pay. And it's the answer is with your supplemental plan that you have, you pay zero. You're covered in full. It really is peace of mind knowing that.
Yes. And of course, with our expectation of healing, we also do not expect people to have to stay a long time or go over the 68 days or the 91 days or the 150 days. And so, but it is good to understand the math and be able to make a decision that's wise. But we still expect healing and expect it in a short period of time. So we're not going to get sucked into thinking that it has to be long, but it's nice to see what the numbers would be and why the insurance might be useful.
On the medical side, so we talked about having Part B with no insurance. You have the $240 deductible this year, 20% after that. When you look at adding Supplement Plan G, takes away that 20%. The last part of Medicare is Part D, looking at adding Part D to that Medicare supplement plan. Helps with the cost of prescriptions, completely optional.
Right.
So most Christian Scientists don't buy that. The plans are offered by private insurance companies, and you get the coverage in one of two ways. So some people don't realize that you can get it option 2, that Medicare Advantage plan has it included in it. When you have original Medicare, if you do a supplement, you can add the Part D if you want to or not, but a Medicare Advantage plan built in. And then late enrollment penalties. I know we've kind of mentioned this briefly. So Part A does not have a late enrollment penalty if you qualify for that premium free. So 10 years worked or longer, most people fall into that category.
Part B is the big one. That's where it really gets, when we see people that only have Part A and they have 70, 72, 75, and they don't have Part B, that gets expensive. So for example, if I wait 10 years, I'm going to add Part B during the general enrollment period, not when I want. I have to wait until that January 1st date. Well, that's simple math. That's 100% more. So if my premium's $175 a month this year, that would be double, and I would pay on that every month for the rest of my life. So it gets really expensive. And we've talked to quite a few Christian Scientists who weren't aware of that. So today it's about making you aware of that and how to avoid it.
Mm-hmm. That Part D prescription drug penalty, there is not a penalty if you continue with having coverage, come off a group plan and pick up a prescription drug plan or pick up Medicare Advantage. If you don't have that continuous coverage, then there is a 1% of the national average that is added to that. It's about 34 cents a month. Where we find that people realize that they have this penalty is they sign up for like a Medicare Advantage plan that is supposed to have maybe premium of $20 or $30, and
or
they
zero.
go, I'm paying
Right?
way more than that.
Why am I paying? Katie's absolutely right. You may have a Medicare Advantage, and anything with an initial, an HMO or PPO is a Medicare Advantage plan, right? So if you didn't have Part D coverage for the last 5 years and you sign up for a plan, even a lot of the plans are zero premium. I'm going to say probably the majority of plans out there on HMO type plans are zero premium, right? The government reimburses the insurance company, so we're going to go with that. But the problem is, all of a sudden you go, well, I have this notice from the government that I owe money. Why is that? And it's because whoever, remember, sometimes you didn't buy it. It was sold to you, how great this plan is. It's going to protect you at zero premium. You get dental and vision and hearing. So why not get it? They never find out that you haven't had Part D and you're going to be subject to penalty. So if you do drop this plan during this time frame, that penalty would go away, right? That's a big deal.
So that is the second insurance option, is a Medicare Advantage plan. So like Jim said, Medicare Advantage plans, they're HMO or PPO type plans. The quickest way to tell if you have a Medicare Advantage plan, because quite frankly, a lot of people don't know, is you'll see on your ID card one of a couple different things. It'll either say HMO or PPO, or if you notice on that bottom right-hand side where it says the Medicare RX, that is a Medicare Advantage plan because it includes the prescription drug coverage.
That's exactly how you tell, because people go, I don't know what I have. And it's like, look in your wallet and pull out the ID card from an insurance company. And if it has it on there, you have an HMO type plan.
I have had so many non-Christian Scientists or Christian Scientists where they don't know what they have, and I'm like, take a picture of your ID card and text it to me.
Us, right?
Because they don't know. Right. Medicare Advantage plans really are not Rinky friendly, and they include that prescription drug coverage, which people don't realize that they have. Now, so between October 15th and December 7th is when you can cancel a Medicare Advantage plan. So if you have one and you don't want it any longer, you can cancel it during this time of year, and the coverage ends December 31st.
Right. You go back and have original Medicare. And before you do that, we really recommend a conversation about, maybe getting a supplemental plan in lieu of that Advantage plan. And the nice thing about dealing with Christian Scientists, you're so healthy out there. A lot of non-Christian Scientists, they can't get those plans right now because they have ongoing health issues, and most Christian Scientists don't. So when they ask you, have you seen a medical professional in the last 5 years or 3 years for any of the following, 99.9% of the time, the answers are no. So that would allow you to get that supplemental plan. Because last thing we want to do is take something away from you, even though you think it may be beneficial, even though you may not be able to use it. Like, for example, at Arden Wood, we want to make sure you have something, a backup, right, ready to go that you know you can get it. Last thing we want to do is be a disservice to you.
So what about long-term care? Because we get this asked quite often, does Medicare cover long-term care? And it really doesn't.
No.
Long-term care is to help with those activities of daily living. It's care when you need a little more help with healing, or you need help with the practical day-to-day items. So we look for policies. We're constantly talking to insurance companies, trying to explain to them Christian Scientists and try to find products that are going to be friendly to Christian Scientists. They work really to help you. We are looking for plans that are going to pay a cash benefit so that you can use that long-term care benefit as you see fit.
And that was, I know we kind of went over a lot there. So cash benefits are ideal for Christian Scientists. So if I have a long-term care policy, most of the traditional ones, right, 98% of them out there, and a lot of you have them, you purchase ones where you maybe thought there was a Christian Science rider on there, and there's not, right? Maybe it was sold to you that way, but when you look at the contract, and I've looked at several for so many of you out there, and it's not in there. So those policies require you to receive care from a licensed facility, for example, in the state of California. And we know you're accredited and you're healing, helping people heal, but those traditional policies can't be used at Arden Wood. If I have a policy that pays me cash, and the insurance lingo is indemnity, so they're going to indemnify me that benefit. So if I have a $5,000 or $10,000 a month plan, they're going to give me a check, in this case, once I need it, for $5,000 or $10,000, let's say $10,000, because now you think that's a big number, but quite honestly, that doesn't cover a lot anymore, especially in the Bay Area. But I have that money paid to me directly. So if I'm a Christian Scientist, I can use those monies for whatever I want. If I want to stay at Arden Wood, right, to get healed, I can use those monies there. I can pay my grandchildren to go shopping for me. I can pay my neighbor to take me to the doctor's office. I can pay for a trip if I want to go on a cruise. I can do whatever I want with those monies. Once they're paid to me, it allows me to do whatever I want with the money. There are no restrictions. There's no, you can only use the monies in a licensed facility or anything like that. So, I mean, we've been on this crusade, this mission for the last 5 years to find plans that we call them Christian Science friendly. And by the way, just so you know, I've explained more about Christian Scientists to insurance companies in the last few years. None of them understand it. You probably go through this. I have to make sure and go, no, this is, you know, it's, they wanted to know. I had one insurance company ask me if they were Christian. I go, well, the name is Christian Scientist, and you've heard the Christian Science Monitor, right? So it takes a while for them to understand. And I go, we're trying to find plans that are incredibly helpful for them. I go, one thing God has blessed you with is most all of you have incredible health, right? You really do. I mean, I talk to people in their 80s and 90s, and
you take good care of yourself.
You do. And that's, insurance companies want that kind of risk. They just don't understand it. They keep coming back to me and go, well, if they're so healthy, how come they're not going to a doctor? And I go, think about what you just asked me, right? If you're so healthy, why aren't you going to a doctor? Because they think you're hiding something. That's the idea for insurance companies. They don't trust people that don't go to the doctor all the time, right? So that they can check on medical records and make a decision whether they want to insure you or not.
So that's why what we're trying to do is we're always trying to find plans that are going to work best for Christian Scientists.
And we had one. We're using Nationwide, right? Great company, and they changed on us, right? If they get a new person in their marketing or VP of marketing, they say, well, you know, that plan we were using, well, we're going to change now. You can't use it to people up to age 75. Now maybe at 65 or 60. And so Katie can attest, we're trying all the time. And I
Mhm.
think I'm kind of excited because I
We'll
think
talk
we
about
found
it next
another
week.
option.
Mhm.
No, I know, but I mean, it's a big deal because you keep getting the door slammed in your face, right? Time
It's
after
so
time after
frustrating.
time. And it's like, okay, well, we're going to keep knocking on doors. So,
So, real quick, when we talk about long-term care, if you don't have a plan in place or coverage in place, then you are self-funding. So, you're going to have to decide what assets that you want to set aside for care. The second option is Medi-Cal in California or Medicaid elsewhere. What this does is that really takes away your options because Medi-Cal or Medicaid is making decisions on where you get care. Or the third option really is insurance. And no one's like, hey, sign me up for long-term care insurance. So we look at asset-based long-term care policies. When we're talking about asset-based long-term care policies, really they have some stuff that all of them have in common.
right. I'm just going to go back to this slide for a second because John said something at the beginning about planning. You need to have a plan. Right? You may think that you're never, and I hope you never do need any type of extended care or maybe some extra assistance, right? If something happens, if you have a fall or prolonged sickness or something like that. And we hope that never happens. But I guarantee you, you know who's worried about it? Are your adult children, because I talk to them all the time. So it's a hard conversation to have, but you need to. And John's talking about doing the planning, and I think it's excellent. You have an estate planning attorney coming, talking to you. But you have to realize your adult children are incredibly worried about you. They worry about you being okay. They worry about assets. They worry about everything, right? They know the cost of care. They really do, and they want to make sure that you're taken care of and yet maybe preserve some of those assets, not only for them, but also their favorite charity like Arden Wood. So that's what we try to do. We try to mitigate those expenses in retirement and show you options. And Katie talked about self-funding, because I get that all the time. Well, I'm self-funding for that. I've got 100,000 set in a CD, and that's what I'm going to use for my healthcare if I ever need it, right? So we see that. So we're going to talk about some different ideas today where maybe you can self-insure with an insurance company. I know that sounds weird, but we're gonna explain it to you in a minute here.
So asset-based policies, general term, really what that means is that it's got three different functions. You either need the care and you have a tax-free long-term care benefit. You can cash the policy in and get some or most of your money back, or you pass away and then a tax-free death benefit is paid to your beneficiaries.
And the reason you can do that, because instead of buying a long-term care policy, you're buying a life insurance policy. And like you go, well, I don't want life insurance, I want long-term care. One of the reasons I love asset-based long-term care, simply because you're going to get a benefit back. So if I put money into the policy and if I passed away, my beneficiaries are going to get a tax-free death benefit. Number one, that's the advantage of a life insurance policy. They're tax-free. If we have the long-term care rider or a chronic, a lot of companies call it a chronic benefit, I can take a portion of that death benefit, and sometimes, Katie, it triples or quadruples. If there's, I hate to keep using numbers, but round numbers, 100,000 in the policy, for example, and by the time I need it in my mid 80s or later, I may have 3, 4, or 5 times that amount for long-term care. So maybe 100,000 is turned into 500,000 for care. So it's a benefit. And if I decide that I don't want it any longer, you can cash it in and get most, or this plan I'm going to show you today, where the principal is guaranteed, you can get all your money back, right? So that's why when I say self-insure with an insurance company, you still own that asset, right? In this case, it would be a life insurance policy that you own and you control. The advantage of what we're going to talk about is a single premium life insurance policy. And that's exactly what it is. You put in a one-time premium payment. And you can call us. We can send out examples of this to anybody interested, but you put the money in there. So I'm going to keep using 100,000. You can put in 50, you can put in more. We've had people doing 120, 180, 220, 79,000. all different amounts, okay? But 100,000 is easy to use. So if I put 100,000 in that policy, and I'm just going to use maybe a 65-year-old, for example, maybe that money turns into 220,000 of death benefit. You go, well, why is that a good thing? Well, I still have my $100,000. So if I don't want it in 4 or 5 years and I cash out, the company we found, right? You get all your money back. You get your premium back. And most of the policies will have a little more in there, but still to know that my money, I have control of that money if I want it. In the meantime, if I ever did need it for care, I can pull that money out and it's tax-free. That's the beautiful thing about life insurance policies. We're talking tax-free money that I can pull out if I need it for care. Since that money is a cash benefit, if I decided I wanted a healing experience at Ardenwood, for example, I can use those monies for whatever I want, including a stay at Ardenwood, right? It's just another way to do it. And this one policy we found, they actually even have a 12% bonus going in, which I didn't believe until I saw it, right? I have to see it and understand it before I'll explain it. But so you put 100 in, they automatically make that $112,000, right? They added on to the death benefit actually. But it's a unique plan. And the best part about this is we finally found a company that says, listen, we're not going to request medical records or make you jump through hoops to take a paramed exam. Paramed exam is when a nurse would come out and ask you health questions, measure you, things like that. This one does health questions only. So if you can answer no to most of the questions, you're eligible for this plan, whether you want it or not. But it's a viable option, and we have been trying to look everywhere, and we think we found one. Again, it's not for everybody, and I'm never going to say, hey, you should put all your money in there. But again, if you've got money set aside for a rainy day in the event that you need it for care down the road, why not? We call it leverage your money. I mean, John knows that term where you put money in and we leverage it. So 100 turns into maybe 200 or 250. So you have more. And quite honestly, I have 3 adult children, but honestly, they would rather see 100,000 turn into 300,000. So instead of them splitting 100,000, they would each get $100,000. So most adult children are on board with this type of plan going, well, your principal's safe and there's more for everybody. Or in the case that I wanted to leave more to my favorite charity, right? That's another viable option where I can name Ardenwood as a beneficiary. So all kinds of options. And I've really tried hard to find somebody, and we're happy to share that with you whenever you like.
Most important thing that you need to know, because I know we went over so much information today, is that you can call or email Jim or myself for help. There's never a charge to work with us. So the insurance companies pay us to help you. So if you're looking at doing like a Medicare supplement or long-term care policy, if you give us a call and we help you, that's how we make our money. And like Jim says, his wife doesn't let him work for free. So also our website as well, whatsmedicare.com. And then I know at the end, they're going to put up our contact information so you can reach out with any questions that you have.
Yeah. And right now, just so you know, this is a Medicare open enrollment period. So we're really good about trying to get back to people in a timely fashion. The problem is when your phone's ringing 200 or 300 times a day and you're going through hundreds of emails, sometimes it may be tomorrow or the next day, but we always try and get back to people as soon as we possibly can.
Bear with us during this time of year, please.
Okay, so I think we're going to look and see if we have any questions out there, John.
Great. Thanks, Jim and Katie and Nancy. One thing we want to mention was about advanced healthcare directives. I don't think did that get covered? Let's say that real briefly. Nancy.
Sure. Let me jump in on that one, if I may. An advanced healthcare directive is a document that you can allows you to determine who can help make healthcare decisions for you if you were unable to make them yourself, or if you just like someone else to take the reins for a while. And this is helpful For Christian Scientists, we have a sample on our website at ardenwood.org, which has some specific language that Christian Scientists might appreciate, where you can actually designate that what you really want is Christian Science care, should there be a need. So what's helpful is that you can go through this document, make your decisions, identify the person, maybe it's a family member, maybe it's a friend that you would like to have make these decisions for you in the future or help you make these decisions. And then you have that conversation with that individual, make sure they're on board with you. And then this is a document that you can show your family, those adult children, and just have a discussion about as part of the planning process, so that they're comfortable with what your requests are. And then lastly, once that is formalized with either 2 witnesses or notarized, then you make sure that you have a copy of it readily available, whether it's electronic. You'd obviously want the person you've appointed to be at that, have a copy of it. And then you might also, if you're in this area, you might want to give it to Ardenwood. So we would have it for you as well. And then just have it in an available place in your home. So it's a document that's helps you walk through the process of making some decisions ahead of time, and can be very useful if, as John said, if you ever end up in a choice of care that's not your first choice. This healthcare document does allow another person to advocate for you that you'd like to be in a Christian Science nursing facility such as Ardenwood. That would be your first choice. So,
right. I think that's so important, Nancy. I know John's given us a couple examples, right? If that does happen and you end up in maybe San Francisco General, for example, John, right? And
Yep.
you want to get back to Ardenwood or get out of San Francisco General, they're not just going to release you, right, and let you walk out of the emergency room.
Yeah, it really, this whole discussion is about trying to ensure the care that you would like to receive. In terms of having all your documents squared away ahead of time, because this is important and the costs are high, and everyone's trying to do the right thing. As Jim mentioned, I found myself I was at the car dealership, passed out, and I woke up at San Francisco General. If you don't have a way that outlines your wishes, that is documented, very difficult to go to where you want to go. Once again, no one wants to be sued. Everyone wants to do the right thing. So
Exactly
something
right.
to really make sure you have that document for sure in place. We've got a lot of questions. We're going to be running over, so I hope people can stay with us.
We're good.
The first question is, what determines Medicare eligibility? That is, the individual's present need for admission. Nancy is probably...
yeah. Well, here at Ardenwood, a Medicare admittee would probably be someone who no longer could be cared for by a loved one at home. It's a care need that needs in a Christian Science journal listed experienced nurse to oversee the care and know what is best to provide care for healing. It would be something that if you weren't a Christian Scientist, you might go to an emergency room, hospital, or a rehab facility for.
Exactly. Next up, does Medicare B pay for custodial care?
No, does not. Custodial care in the non-Christian Science world is long-term care. That's another word for custodial care. It's non-skilled care. Medicare does not cover you under A or B or a supplement or an advantage or anything you can think of for custodial or long-term care. It does not. Skilled care only.
Mhm.
Exactly. Why are so many Christian Science nursing facilities opting out of Medicare insurance for patients paying their bills?
Well, I can't answer that for other people, but I can say that As Christian Scientists, we have paid into the Medicare system throughout our working careers, and we've put the 1.65 out of our paycheck every time. And so we've put money in, and it certainly makes sense that we should be able to use those Medicare benefits in a setting that is in context with our own faith. And so having a Christian Science and nursing facility allow and accept for Medicare payments allows us Christian Scientists to be able to use our Medicare benefit in that way. So that's a reason for a facility to have Medicare available.
So I've got a question. So why is it we talk about an individual or a Christian Scientist, it's not really in their best benefit to have an HMO, a Medicare Advantage plan, like maybe from the K company, right? That's very popular in San Francisco, the Kaiser plan. Why is that not a good something to have? Why would it be more beneficial for them to have original Medicare to be able to go into Ardenwood, for example?
Yeah, thanks, Jim. That's a really good question to try to clarify all the good facts you gave us earlier. So just to reiterate, Part A, original, is what is accepted at a RNHCI such as Ardenwood for Medicare covered care. And your choice is between original care, A and B, or an Advantage plan. It's one or the other. So if you choose an Advantage plan, you're joining a private insurance company that has a limited number of providers that you can seek care for. And no RNHCI is a member of any of those private groups. So, although an Advantage plan by law is supposed to offer all benefits that original Medicare does, and therefore should allow for RNHCI care, in effect, they don't have a RNHCI in their network, and they don't even know what a RNHCI is in most cases. And so therefore, if you have a Medicare Advantage plan and want to go to a RNHCI, there are many different steps that have to happen. Pre-authorization is required by Medicare Advantage plans, which means you're also supposed to have gone to your physician and they have told them that you can now go to a RNHCI, which of course is not in keeping with our beliefs. Once you're here, and we're trying to make sure that your insurance will pay, we then in the backside have to go through and try to find the right person that will help them understand how a RNHCI should be paid, how this service is covered, et cetera, et cetera. And most cases, we've had the patient has had to go through an appeal process to make sure that they get paid. Sometimes it takes 6 months to a year for that to happen in a positive way. So it's a long, drawn-out process. And whereas Part A, original, you come in, we file it, everything's fine. So there's no intrusion in any other way. So that's some of the reasons. But I should also just say, though, of course, it's an individual decision, and there are times when a Medicare Advantage plan seems truly to be more of an advantage to some folks, and that's perfectly fine. It's your choice. But we just want to make sure you have all the facts so you can make the right decision for you.
Yes, exactly. Thank you, Nancy. Typically, we call them disadvantage plans for Christian Scientists. Again, just from a business perspective, which is what I see, as well as loving care, which we provide. But you provide, say, instance, take care of a patient for a period of time, and then you don't get paid for over a year, or sometimes in the past, not get paid at all. I know the federal office of the Committee on Publications is working actively because there are so many of these Advantage plans popping up all the time. There are more and more of them. That's why you see so many advertisements for them. Anyway, Medicare Part A is the best if you would like Christian Science care. Next question, can you enroll us even if we live in another state?
Yes, we are licensed nationwide, so we can help with supplements in other states.
Thank you, Katie. Will we have access to these slides after the webinar? I don't remember how we've done
Yeah,
that.
we can send those
Yeah.
over. Mhm.
That'd be good. On request. Yeah, just if you email us, we'll get them out to you. I don't think we just broadcast them, but those that request them can receive them. Is there a charge of at least $174.70 a month for Part B, even when not using any services?
Yes, that's the government's Part B premium this year. It's $174.70 a month. It's also adjusted for income. So if you have higher income, without going down the rabbit hole too much, they're going to charge you more, right? So they do. And every year they do a 2-year look back at your modified adjusted gross income. And if the threshold for an individual was 90, what was it, Kate? No, $103,000. So again, since I'm going down the rabbit hole, if this year in 2024, they're looking at your 2022 tax return. They just don't trust you. So they're going to pull that from the IRS, right? And they're going to get that number. If you're an individual, it's more than $103,000. You're going to pay more than that $174.70 a month. If you're a couple, you just double it. So if you had more than $206,000 in 22, you're going to pay more than the standard Part B premium. So the answer is absolutely you have it. But when you need it, and if you don't have it, that's when you're going to have to wait to add it during that general enrollment period, and they're going to fine you. So I think it's really prudent to look at getting that and adding it when you can to avoid penalties myself.
And just to summarize again how that affects a Christian Scientist who may want Part A, why do they want Part B? 2 reasons. One, if you want the Medicare supplemental that's going to help you pay the deductibles and the coinsurance for Part A, you have to have Part B. You can't get a Medicare supplemental unless you have both A and B. So that is a financial decision that you make, that you want to pay the premiums of Part B so that you can get the Medicare supplemental if that's important to you. So that's a package deal. The other reason that you'd want a Medicare supplemental policy, that you'd want Part B, is just as they've mentioned before, if you ever had an emergency care need, it's helpful to have that in place. So those are some reasons to think about the possibility of that. But again, if you came to Ardenwood and needed care, Part A is all that you need.
Great. Thank you, Nancy. Is it possible to get the Medicare IRMMA reduction you were talking about if you are retired early, and have done a Roth conversion from a traditional IRA from work, which kind of inflates our earned income until 2026?
Right. Yeah, you can always try, right? So every year they do a 2-year look back. So we said in 2024, they're looking at your 2022 return. In 2025, they're going to look at your 2023 return. And whenever that income hits, so if you did that conversion and it's going to show in your 23 return, what you're going to pull next year, you're going to have an IRMA. IRMA is an income-related monthly adjustment amount. It's a surcharge or a tax, but you can always appeal it. But really on those are kind of hard because you've got the income and you didn't have a life-changing event. You're already retired. You're not working, no work reduction, your spouse is still living. So a lot of times, unfortunately, you just have to pay that.
Well, and on that one, I think they indicated till 2026. So if that's ongoing, that income hasn't reduced, they're not going to give that to you if the income hasn't reduced.
But again, I remember it's the government. I've seen them do things where sometimes they've done adjustments. So all they can say is no.
Yeah.
You always want to ask. All they can do is say no. That's me.
I love it. What if I'm only enrolled in Part A? Can I get a supplemental plan? I think we just answered that.
Yes,
We
you
did.
just answered
Yeah,
that.
no.
Nancy did our job. Okay.
She did. Good job, Nancy.
And just to reiterate again, no. The answer is no. You need both Part A and B in order to have a supplemental plan.
I will say you also have to have A and B to get a Medicare Advantage plan as well. So either option requires both.
Good point.
Well, that answers the next one. Is Part G an Advantage plan?
No,
So, no,
no, it's a
exactly.
supplemental plan. Big difference, right? Yeah,
It's the anti-advantage plan.
it's the end.
Exactly. Dis, yeah, or anti, yeah. The figure of 255 for Plan G, is that $255 a month?
That would be the deductible.
Right.
I'm sorry. Sometimes we talk so fast through
Right.
things. So
Right.
the deductible is what you would pay before the insurance or before Medicare kicks in if you needed something medically next year. So if you needed a bone break and you needed a bone set or you needed some emergency, something happened, the 255 is the deductible that you would pay before the supplement and Medicare kick in.
And once you hit that number, everything else is covered in full.
Mhm.
I have Plan G myself, and this year was 240. Next year that we're guesstimating about 255. But again, once you hit that number, if I have any type of emergency services or anything under Part B, ambulance rides, right, which are crazy expensive, physical therapy, anything like that, it's covered in full. I don't pay a dime after I hit that deductible. So if you think about your out-of-pocket exposure, for myself, this year was $240. Next year, it's going to be around $255. That's it.
Thank you. What if someone is in a facility that does not accept Medicare? Does Medigap cover any expenses that are associated with that care, for example, hospice?
No. So the supplement only pays if Medicare approves an expense.
That's right.
If Medicare does not, the supplement does not. The supplement's not making medical decisions. They're just paying secondary to Medicare.
Right.
Yes.
So if the provider takes Medicare, they automatically take the supplement. You don't have to ask if they take the supplement. They automatically do, whether it's a hospital, facility, doctor, Ardenwood, right? You automatically take that. I know we love the AARP United Healthcare plan because they pay really well. I know they pay providers, they reimburse them pretty quickly.
Thank you. What do you recommend for time spent traveling to other countries?
So there's a couple different options. So sometimes when you book the travel through a travel agency, they have coverages that would cover you. If not, we do have insurance companies we work with, and you can always reach out and we can get you the information on that.
But Medicare only covers you in the United States or its territories. So if I'm on vacation in Puerto Rico, right, that's territory, I believe. Good.
Mhm.
I'm covered there, right, under Medicare. If I go to Costa Rica or Colombia or Italy, that is not part of the United States. Medicare does not cover you when you travel abroad. If I'm taking a cruise, I hit international waters,
Correct.
guess what? That is not the United States, right? So we always recommend a travel policy, especially if you've got Medicare and a supplemental plan. The supplemental plans maybe have some type of reimbursement, but it's a hassle. These travel plans are so inexpensive, and you can purchase them for the duration of a trip if you want 14 days or 21 days, or if you're going to travel a lot, Katie always recommends you buy for the whole year. It's ridiculously inexpensive to get $1 million of coverage, whether you're traveling to Israel or Italy, or I'm trying to think of all the Iceland, I'm trying to think of all the I companies or countries, John. Anywhere,
Indonesia?
I'm sure there's more, yeah, wherever you go. But it really is. I always say Carl Malden, don't leave home without it, right? You want to have that. And just one quick word about the Medicare Advantage plans. If you do have a Medicare Advantage plan, they do cover you anywhere you go, in or outside the United States. So that is part of the Medicare Advantage plan.
Mhm.
Thank you. Can you buy an Advantage plan and the supplement plan?
No, it's either Advantage or supplement, not both.
Right.
Sorry, I'm giving short answers because I know we're over on time.
No, yeah, and it just sometimes people want to hear these again,
Yeah.
so I get it. We've got several more. Why
We're
don't we
good.
say that we'll go? Can we say we'll go till 5:20, 5:30? Is that
Fine,
okay?
yeah.
We've got still a lot of people online,
Okay.
and these questions have come in. But let's say a hard stop in 20 minutes. Is that okay? 5:30? 5:30 we cut. I pay about $60 a month for an Advantage plan. Is a supplemental plan cheaper?
It depends by what you mean cheaper, right? So with my supplemental plan, I pay a higher premium myself. And then my out-of-pocket exposure, right, is $240 this year. That was it. And we know next year it's going to be in the 250 range, 255. So if I have a Medicare Advantage plan, I may pay zero premium. I may pay
$60
$60 premium. I may pay $90 premium. It really depends. But you have an out-of-pocket maximum on all policies. Anywhere from $3,900, I've seen some $4,900, I've seen some PPOs at $8,000. So if you think about your worst case scenario, I would rather pay a premium to an insurance company, in my case, maybe a little more than the 60, maybe it's 160 a month, but my exposure is $240. If I have an Advantage plan, and Christian Scientists, this may not be pertinent to you, but we have a lot of people, if they get on an Advantage plan and they have any type of infusion services like chemotherapy or anything like that, you're on the hook for 20%. They don't tell you that when you buy those policies. That's where that out-of-pocket maximum becomes important. If it's $4,900 or $8,500, you're going to pay that out of pocket. So I don't think you can use cheap, right? My mom always said never buy cheap shoes, cheap mattress, right? We don't buy cheap furniture or anything like that because it always comes with a price. And that's, if you look at that with a Medicare Advantage plan, it's the same thing. If you're buying cheap, you're going to get exactly what you're paying for, right?
Premium-wise, Advantage plans are going to be less expensive than the supplement, but overall, they may not be.
Yeah, I'm not a fan. I mean, we're brokers and independent. If people want to purchase that, they can. We explain the pluses and the minuses, but I'm all about freedom of choice. Original Medicare allows you to go anywhere in the United States. There is no list. And that includes if I'm back in VA, if I'm in Ardenwood, Rinkies, anywhere I go, and the supplement follows. If I'm with an Advantage plan, I have to worry about restrictions. Am I really sick? Am I hurting? Am I out of area? Am I covered? Who wants that in retirement? To me, it's peace of mind, right? So don't be cheap, right? Don't buy cheap shoes and don't buy cheap insurance. That's my motto for today, John.
Here's a very good question. Thank you, Jim. What are the impending major changes to Medicare? How will those of us applying to Medicare be impacted, and others already on Medicare? Good question.
So the big changes coming in 2025 really pertain to the Part D prescription drug plans and Medicare Advantage plans. Medicare supplements are absolutely going to be fine. They're going to continue on. Because the government passed the Inflation Reduction Act, the IRA Act, they've capped prescription drug costs next year at $2,000. And I know a lot of Christian Scientists don't use prescriptions, but the reason the change is because now that they've capped those costs at $2,000, the insurance companies are on the hook. Government said, well, we're not paying for it. So you got all the money, insurance companies, you pay for it, right? So insurance companies go, well, I guess we're on the hook for that. Well, you know what we do, John? Well, we're a pass-through entity. So if we're going to pay more, guess who's going to pay more? Is the consumer. Consumer's going to pay a lot more.
Just pass it through.
We've seen, because of this passage of the Inflation Reduction Act, we've seen premiums double, quadruple. We've seen them pull plans. They've cut our contracts because insurance companies don't want to pay consultants or brokers on a lot of these prescription drug plans to help the consumer now. So they've really created a mess. They didn't want to, but that's what ended up happening. So it was a good thing, but for most of the consumers out there, if you have a Medicare Advantage, a lot of those plans left the market. All the Part D plans have left the market. So you really have to look out there and see what's available. Nothing's worse than having a Medicare Advantage plan than your provider calling you and saying, guess what, John? We no longer accept that plan. And you go, well, wait a sec. Where am I going to go for service? Look what happened at Scripps. Scripps is a massive center down in Southern California in La Jolla, right down outside of San Diego. Last year, they dropped 33,000 Medicare Advantage members because they said, we're no longer dealing with Medicare Advantage plans because we can't make any money. We can't stay in business as a medical center or a hospital group. And you're seeing that happen more and more all over the place. So those are some of the big changes that are happening. So you need to be a good consumer, even if you're a Christian Scientist and think that's not going to happen. I still would not want to have one of those plans. I would much rather have original Medicare and have all those options.
And we didn't talk about a lot of those changes because a lot of them
Right.
apply in the prescription drug plans as well.
Exactly. We didn't think that was
Yeah.
appropriate, but since you brought it up, that is what's happening
Yeah.
out there.
Mhm. Good to know. What are the options if you don't have Plan G and you are in a skilled nursing place such as Ardenwood? Do you qualify for Plan G?
No, you don't, unfortunately. If you're already, it's like your house is on fire and you're trying to call your insurance guy and say, I need some more fire insurance. They won't give you the plan. You have to get the supplemental plan when you're healthy enough. And Nancy, maybe you may have some views on if they come in with just, it's better to come in, right, with original Medicare with Part A and B, even if they don't have the supplement,
Or even, part of
or even just Part A.
Sure. Yeah, exactly. Part A is really all you need. These other things are financial tools that help you sleep at night if that's a concern. Yeah.
I think just to your point, Nancy, too, and well, everyone's point, in terms of this is where sometimes it's good to talk with your family because the family does want to know, Mom, Dad, what's the plan?
Right.
How are we prepared for something? And I think these conversations are so vital to be had between family members to know what's going on, so everyone's clear in terms of what the coverage is and what the coverage isn't. Sorry. Go.
Totally agree with the holidays coming up. What says, holidays better than having that conversation, right? It's important. Everybody wants to not talk about it, but it's like the elephant in the room. The adult children, I mean, we talk to so many people where they're all worried about, what about my adult children? What about this? I don't want to be a burden to them. What are we going to do? Have you talked to them? Well, no, I'm kind of keeping everything so that they'll get it if I pass. I'm like, well, you need to have a conversation when you're alive so that they all understand your wishes and what you can do with the monies, etc. But it's so important to have that. And you're right, John, it's not an easy conversation, but it's an essential, it's an important conversation you need to have with your family.
Absolutely. Next up, on that long-term care policy you just talked about, are there any restrictions or can you use it for any medical expenses or practitioner costs? I think they're probably emphasizing the practitioner costs there.
Yeah, the answer is yes. There are no restrictions. Once you receive the monies, you can, right? You just have to, we'll explain that. I don't know if we want to go into detail here. I think
so.
Yeah, once you're eligible to receive the benefits, there are no restrictions on what you can use the monies for.
It's a cash benefit.
Right, it's a cash benefit.
Great. So that's what you want to call Katie and Jim. I turned 70 in January, but I'm going to continue to work for another 1.5 years after that. I figured I should sign up for Social Security to start in January, but should I also sign up for Medicare? I'm covered by a good health plan at work. However, will there be a forever penalty if I don't sign up in January?
So a couple questions there. So when you turn 70, right, you absolutely want to turn on Social Security because they're not going to pay you anymore. They call them delayed retirement credits or that 8% simple interest a year. You're not going to get that benefit any longer. So you absolutely want to turn it on. If I'm working for a company and I start my Social Security benefits at age 70, I'm required to have Part A of Medicare. It's not an option. They're automatically going to send you a Medicare card with Parts A and B on there. If I'm still working, I'm going to send it back to them and say, I'm still working, cancel my Part B. I don't need it. But you absolutely have to have Part A when you're receiving Social Security benefits. And don't wait. After age 70, that's your money. You've paid into that system all these years. You want to start taking it then. There's no penalties. You can make $1 million a year. There's no Social Security. There's no offset when you're working full time. You absolutely want to take that money. And if you're not going to use it, give it to the church. There you go.
There you go.
Right?
What is the cost to add Medicare supplement such as Part F or G? Some of these are repetitive.
So that is all over the board based on age and home state. If you want a quote, reach out to us.
Perfect. If my spouse has the group health plan that covers me and I'm over 65 and have not signed up for Medicare Part A or B yet, am I free of the penalty?
As long as that employer has 20 or more employees, yes, you are good. You're covered by the group plan. And then when your spouse is retiring and or you're losing the group coverage, adding Part A and Part B, yes, there will not be a penalty.
Right.
Yeah.
Great. Medicare approved facilities have to accept RNHCI, right? Yeah, Medicare approved facilities have to accept.
So maybe is Medicare, is
Misunderstanding the question.
a Medicare approved facility, right, for a state?
Yes. Not all Christian Science care facilities are RNHCIs. Some are in the Medicare program and some are not. So, but if they are, for instance, we accept Medicare. That's what RNHCI means, right, Nancy? I mean, that's
Yeah. We're designated, as John said earlier, by Medicare as a religious non-medical healthcare institution in Medicare's eyes. And
right.
Yeah. So
you know what? Every year they send out the Medicare and You guide. And so every year it's in there. So if you want to see it for yourself, they can go and look at Medicare and You under Part A services, and you're going to see coverage in a religious non-medical healthcare institution.
I believe that's on page 28.
Right.
I have it right here and I can't find it. Here it is.
We see it a lot. Okay.
This is what it looks like. You probably got it in
Is
the
it on
John?
page 28? Am I right? It's
No.
on page
John.
28.
Okay. This is
All right.
competition here. 28. Okay,
Thank you,
quick.
John.
28.
But it is.
Yep,
in
28. Page
There it
28.
is.
Yep.
there. Katie, yes.
Right here.
Okay.
Religious
federal
non-medical
law.
healthcare. Yep.
So that was written in the law by Orrin Hatch and Senator Ted Kennedy. So we can be grateful for
That's
that
a good
years ago.
point.
Yep. In determining income, are pension payments included? Great question.
And anything that falls under modified adjusted gross income. So yes. Mhm.
Right.
If we'd like to make a virtual appointment with you, what information or preferences should we be prepared to give you? How should we prepare for the appointment? What a thoughtful
That's easy.
question.
Yeah, it's a great question. Just like the questions you're asking now, you can ask us then, and you can ask more detailed questions because it's only going to be us on the Zoom meeting.
We ask questions as far as your situation. So you don't have to like study for it or anything.
Right. Yeah. Just
We just kind of have a conversation about
Right.
what's important to you.
Sure.
Everybody's situation is slightly different. As long as you know your date of birth and your home zip code, those are going to be the two
we're
most
good.
important things.
right.
Great. Got 7 more minutes here. If I'm currently on my husband's policy, but over 65 and have signed up for Medicare Part A, when should I sign up for Medicare Part B?
When you are going to be losing that group health plan.
Mhm.
Is there like a 3-month window, or is it?
No, that's only for the initial enrollment period.
Okay.
So if she's 68 and coming off the plan and she has A, she really has plenty of time, technically 8 months, but you don't want to wait 8 months. You want to do it 3 or 4 months prior. That way it's a smooth transition. When you come off the group plan, you have A and B, and then you can get your supplemental plan or supplemental coverage. It's a smooth transition that way.
Real life example. So we get calls all the time. Now is the time of year where people are calling us and telling us the end of 2024, December 31st, I'm
right.
done.
Yeah.
So what you want to do then is now is the time to reach out to Social Security, kind of late October, early November, and tell them as of January 1st is when I need Part B because I will be on the group plan through the end of December.
Okay.
Right.
Yes.
Here's a question that we get from time to time. Is long-term care the only thing? I think I'm assuming that means long-term care insurance. Is long-term care insurance the only thing that will help cover care for dementia type needs?
That I'm aware of, right? Because that's not covered by Medicare. So it's a custodial type care or long-term care. So you either have, some type of long-term care coverage, whether it's through a life insurance policy or a long-term care policy, or a lot of annuities have long-term care riders. That's what's going to pay for that type of care. If not, you're going to start using your assets, right? That's just what they're there for. And if you don't run out of money, you're going to be eligible for Medi-Cal or Medicaid in other states, right? Government assistance. And that's not good.
That means you have a very low threshold. what is it, $2,000 of assets or something?
Pretty bad for an individual, John, right?
Yeah, it's poverty. Yeah. The next question is, I have Medicare Part A and B. How do I sign up for Plan G?
Oh, Katie.
Exactly.
That's where we
Right.
help.
That's a easy one.
So we help
Easy
do
one.
the application. That's how we get paid. That's how
Right.
we have you as a client. And then
Right.
when you have any questions, you call our office and we help you.
I do want to say this because we get a lot of this. Well, I signed up for AARP United Healthcare. Can you help me? And the answer, unfortunately, is no. Once you've signed up through a call center, right, when they make it appealing to you, oh, we'll help you, Nancy, we'll sign up, we'll do everything for you, no worries. And then when you need care, you need help, you're calling an 800 number that sometimes is not based in the United States, right? So if you call us and say, Jim, we purchased this plan through somebody else, can you please help me? The answer is no, we're not your broker or agent of record. Therefore, we can't be of service to you, unfortunately. So sometimes people sign up for it after they hear us, and we're like, if you do it through us, we can always be there and help you. But if you do it through an 800 number or a Joe Namath commercial or something, we can't be of service to you, unfortunately.
And the other benefit, Jim and Katie, is that you folks know which insurance companies are really the best ones to recommend. Although the coverage is identical, as you mentioned, regardless of what company you go with, there are ones that perhaps process claims faster or are more reliable, whatever. But so that's the other benefit of going with Jim and Katie for that chapter of coverage is that expertise they have.
Not only that, we can, I'm sorry, John.
No,
we
go.
can reach out to insurance companies, and a lot of times we have ways of dealing with some stuff that an individual can't. So we had a client that called the insurance company before us, which I told her not to, but she wanted to try to take care of it. And the insurance company told her, absolutely not, we can't do this for you. And so she sent an email and I responded back and I was able to take care of it in a 20-minute call to the insurance company. So you have us basically to help be on your side, to help fight the good fight if something should come up. We're
an advocate for you. But again, if you don't work with us, we can't be that advocate. So
and we've just been so grateful for you, Jim and Katie, because this is complicated. Obviously, we keep getting more questions that are repetitive, but this is complicated stuff. And one thing that I appreciate from Ardenwood's perspective is that we've never had any complaints. Usually when you recommend someone, you're kind of taking a chance because, well, you think it'll go well, but consistently people have been very pleased with both of you, and we've been very, very grateful for that from an institutional perspective. So we're grateful. We have two more questions. We're coming at, we got 2 minutes to go. So let's, two questions and I'll wrap it up.
2-minute warning.
2-minute warning. Is Plan G the same as a Medicare supplement? That's an easy one.
Yep. Medicare supplement or Medigap Plan G. Yes, they are the same thing. Yep.
Thank you. And here's the last question of the session. We'll close up. I'll be 71 in December. I'm still working full-time, but haven't taken Social Security yet. Is there any penalty for not applying for Social Security?
No, but you want to. That money's sitting there. Take the money and use it. If you don't need it, help somebody out. Help your charity, help your children. Do something with that money. You've paid into it all those years. And they're no longer just sitting there. Take the money, right? Please take the money.
Yes.
Right? And you do something good with it. Right?
Ardenwood.
Donation.
Why not?
Get a little slap happy there.
Better in your pocket than in the government's coffers, John. Yeah. I would say.
Truly. There you go. Well, thank you, Jim, Katie, and Nancy. These webinars are always helpful. Gotten a lot of thank yous that were typed in. Please don't hesitate to call any of these three with Medicare or insurance-related questions at any time. They're happy to help. One other resource you are welcome to contact is the Christian Science Provider Network, which works directly with Medicare and insurance companies on behalf of Christian Science care facilities as well as individual Christian Scientists. Another resource for financial assistance available to Christian Scientists of any age is the National Fund for Christian Science Nursing, or the NFCSN. The contact information for all these resources, including Jim and Katie, is available in a moment right here at the end of today's webinar. It'll be posted. Again, the point of this is it's wise to be thinking through your options now. And before we go, we want to remind you to check our website, ardenwood.org, for details about our upcoming webinar events, especially our Christmas program on December 8th. We look forward to seeing you again soon. Thank you again for joining us today, and goodbye for now.
Bye, everybody.
Hi.